Okay, so let's start. Okay, I'm Hisham. I'm based in Singapore. Sorry, it's been a long day, but so my voice has been tired. Together with me is Henning, my good friend. He's based in Bangkok. Perhaps Henning, you want to introduce yourself?
Yes, hello everyone, Sawadee Krap. And Michal, I think we met last year at the Biohacker crypto event in Bangkok. We may have had a chat, but everyone else, very nice to meet you. And if you ever come to Bangkok, please ping me.
You can see my screen?
Yes, all good.
Yeah, good. Okay, excellent. Okay, sorry. I'm technologically not very good. So yeah, so today I'm going to be talking about longevity, hallmarks of aging, and strategies for extending health span.
Sorry, can you make the presentation full screen?
Well, this is the Biohacker group, not the IT hacker group, so you're forgiven.
Yes, yes, as you can tell. Yes.
Yeah, you can see that. Can you see that? This.
Oh, beautiful. Now it's full screen.
Beautiful. Okay, cool. All right. So yeah. So I'm going to be talking about longevity, hallmarks of aging, and strategies for extending health span. Okay. So I'm Hisham. Okay. My credentials. Right. Okay. So if you think about this, right, you think about longevity as the ultimate biohack, right? And to think about it is to think about longevity and aging as a disease. And when we talk about disease, there are mechanisms for disease, right? Pathologies and things like that. So what happens when we grow older or as we age? There are 12 hallmarks of aging, and I'm going to go through this, in a very quickly because I want to spend more time on Henning's talk and then any question and answers, right? Okay. First thing that can go wrong with you is actually your genome becomes unstable, okay, and because of DNA damage over time. Things that you couldn't do about it is basically biohacking. It is code therapy, right? Reduce that damage. Telomere attrition, right? So this is a bit controversial. Some people say, hyperbaric oxygen therapy can protect telomere attrition, right? There's also other supplements, other things which are being researched at the moment for this. Epigenetic alterations, gene expression changes. Things that you can do is basically intermittent fasting or prolonged fasting. Loss of protein misfolding, so your proteins become misfolded and things like that. You can do sauna for this, right? So these are very, very easy biohacking things that you can do to actually reduce the risk of these hallmarks of aging going wrong. To continue. There's actually also mTOR, MPK imbalance. So things like metformin, rapamycin, caloric restriction. So I do this because I have access to this, right? So I take metformin, I take rapamycin. I know that some people who are a bit more famous than me, a lot more famous than me, that like rapamycin, but that's an individual thing. Mitochondrial dysfunction, so energy decline, oxidative stress. So you can take things like CoQ10 or do, high intensity interval training or take things like NMN, which is a bit more controversial and things like that because they don't really, they help with energy, but it's controversial in the sense that, no one can actually really tell whether it helps in longevity or not. Okay. Then there's accumulation of zombie cells, right? Cells which are there but don't really do anything. So you can take things like ficitin, right? That basically removes these zombie cells. Declining regenerative capacity, and this is what we're going to be focusing on for this talk. It's stem cells, exosome therapy as well. Then you go into altered intercellular communication, so chronic inflammation. So, yeah, so if people were to ask me what I take every day, so I take NMN only because I'm not a morning person and I need the NMN to just boost my energy up together with my coffee. Then spermidine, I take spermidine, sometimes calcium, AKG, rapamycin, metformin, rapamycin only once a week, and then other things as well. I do fasting, maybe about 2 or 3 times a week. So autophagy impairment, reduced cellular cleanup, so prolonged fasting, spermidine again, gut microbiome imbalance, then you can take probiotics, and I would recommend things like Akkermansia, right, which a lot of my clients, believe in and take. Okay, actually probiotics, there's a lot of more research that needs to be done into that. RNA processing errors. So this is, I didn't put anything here because this is kind of a very, I would say, advanced, right? So this, we're talking about gene therapies and things like that here. Okay. So longevity treatments and biohacking strategies. So level 1, what you can do. These are low cost, but also high impact. So you can, and if any of your friends are interested in this, right? And everyone here would have heard about all these strategies. Time restricted eating, okay, fasting, syncing with circadian rhythms and things like that. VO2 max and zone 2 training, everybody knows about this, right? Improving mitochondrial function. Sleep optimization, everybody should know about this. Using your wearables to track your sleep and then also deep sleep. Okay, sometimes you can use things like ashwagandha, magnesium. Some people use melatonin. I find that half works, half doesn't work. Cold and heat exposure, and I do this for many of my clients. I send them to cold plunges and alternate them with sauna or infrared light. Okay, and then nutritional optimization, obviously. So this one, personalized micronutrient tracking. And also tracking food, right? Okay, so these are easy things to do if you're starting off. Level 2, then you can do things like, I'm sure a lot in the audience are also doing this. Metformin, okay, debatable. Some people take GLP-1 RAs, semaglutide, liraglutide. I have access to that, so I sometimes take it, right? And so I cheat a lot. So if I increase sometimes in weight, I just inject myself with Saxenda. Okay, then rapamycin as well. Okay, senolytics, once again, quercetin, NAD boosting, NMN. There's other things you can do with this. Peptides and exosomes, right? I believe in them. Unfortunately, in Singapore, you can't really access this, so I send my patients to places like Thailand and work with Henning on this, right? And then blood panel optimization. So I think it's quite important to actually track, your biomarkers, but you don't have to do it, every 3 months or every 6 months. You do a full panel once a year, and then you track whatever really needs to be tracked, and what you're focused on every 4-6 months, right? And then do that. A lot of my patients, even those in their 50s or 60s, are also biohackers, and they do their own kind of charts and everything else, and then send it to me, and then ask me whether it's okay or not. My style is that I am their guide rather than their doctor who traditionally doctors would say, yes, you do this, and no, you don't do that. But usually it's a conversation, an open conversation as to what you are comfortable with, what do you want to achieve, and let's experiment with this. Okay, and I try and do it safely for them. These level 3 is basically the kind of cutting edge things, right? So plasma exchange, young blood experiments. I'm sure you've heard of Brian Johnson doing this. So to look at reversal of your biological clocks. Yamanaka factors, the things that can actually help to reverse some of these kind of hallmarks of aging, quite interesting, but also quite experimental still. I'm really looking forward to this. There are certain side effects that you don't want to do. I think David Sinclair's experimenting with them on himself. Okay, then gene therapy is another thing that's upcoming. But what is quite interesting is if we combine AI and then we personalize supplementation and also the repurposed medications for this, right? So stem cells, I'm not gonna steal Henning's thunder, and he'll cover this more in his talk, but basically what happens to stem cells as we age, right? And this is just one of the hallmarks of aging. And if you want to actually, kind of improve your health span and also lifespan, you need to understand that the hallmarks of aging work together, in multiple ways. So you don't just focus on one. So you have to focus on a few, right? And there are ways of seeing which one you are more at risk of. So what happens to the stem cells as we age? You have a decreased number and potency. I am a firm believer that actually most of the things that go wrong with us is due to inflammation, due to the environment and the lifestyle that we lead, due to microplastics, due to processed foods and things like that. And then we have a reduced ability to repair tissues, right? So there are things that we can do. So we can preserve our stem cells, right? I probably won't preserve mine because I'm 54, and I don't think that they're working too well. Mesenchymal stem cells, and I think Henning will be talking about that. Okay, GDF111, things that can actually try and boost up your stem cells. They're still experimental though. Okay, and then pluripotent stem cell applications. So we're talking about basically growing a new liver based on your stem cells for you, right? Okay, and then once again the role of AI regenerative medicine. Okay, so I think the future for longevity is quite exciting, even in a very restrictive environment like Singapore, regulatory environment like Singapore. It is still exciting because that's the convergence of people doing the research, the AI, and then people who are actually experimenting with them. So I think I think what you guys are doing are great. It'll be great to actually kind of like track whoever is doing what and things like that, and whether it works for them and things. Personalized longevity stacks, right? And then AI drug discovery, and that is a must, because the thing is, drug discovery and going to market is taking far too long in this day and age. It takes 10 years to get a drug approved, costs billions of dollars, and we don't have time to wait for that. Okay, so that's my, sorry, I rushed because I know I want you guys to hear what Henning has to say, but that's my presentation, and I will hand it over to Henning. And but we will wait for questions and answers. I saw someone raising their hand.
No, I raised mine by mistake. I wanted to do the talking about it, but I raised my hand instead, so you can ignore it.
Okay, fine, great. Okay, so over to you, Henning. Okay.
Yes, thank you very much, Hisham. While I'm trying to figure this out, I wonder how many of the participants, attendees, actually have heard about hallmarks of aging, because I recently had a similar talk here in Bangkok, and out of 30 people, no one knew it. That really surprised me.
Oh, Vincenzo, of course, Michelle, yeah, yeah, John. Wow, this is a bit more advanced group. That's very good.
Okay, I need to make some changes here in the settings somehow. Hold on. Okay, give me 1 second. I really tells me to restart the browser. 1 second, I apologize.
Thanks to Hisham, by the way, for your presentation so far. One quick question. The hallmarks of aging, that's very much a lot of different areas, right? So, and as you said perfectly, you have to look at all at once because it's like it's one body, right? And I found that one of the biggest challenges, also personally.
It's which one to start off with, right?
Yeah, like you have a few biomarkers which are important, but then you always have to look at the whole, right? Yeah. So, yeah, if you have comments later on that, would be cool. How you deal with that.
Well, maybe I address that after Henning's talk, because I actually have a philosophy with that. Okay, right. Are you muted, Henning?
Okay, I'm no longer muted. We're getting there. So what was the conclusion? Do most people know the hallmarks of aging?
I think half of them knew, yeah,
Okay.
which is good.
Good, right. Okay, thank you, Michal, and thank you, Dr. Hisham, for making that connection. My name is Henning. Disclaimer up front, I don't have a medical background. I don't own a clinic. I don't own a hospital, but I've been working in the medical tourism, regenerative medicine space since 2008. So I've been very fortunate to work with very smart doctors and have countless conversations with clients and physicians in this space. So today I will share you a little bit about stem cells, the fundamental knowledge, clarify some terminology, which is often getting confused, and also show a case report at the end. I'm German, but I've been living in Asia since 2008 and the last 10 years or so in Thailand. And I have my own company now called Imagine Health. We're now in the 3rd year, and we do we are matchmaker in the longevity intervention space. So we unearth great value interventions here in Thailand and promote this internationally. Make sure that people like yourselves and others learn about it, get educated about it, and get in the position to make a confident decision. A little bit about myself, so you know that I'm in this space, and I'm actually have very strong relationships here in Thailand. Bangkok Hospital, BDMS, Thonburi Hospital Group on the left. These are 2 leading doctors of Vitalife, BDMS Wellness, Thainakareen Hospital, to name a few. This, for example, is Dr. Vanviput, who is the lead doctor at Vitalife at Bumrungrad. On the right is also a leading anti-aging longevity doctor in Thailand, Dr. Deer, that's his nickname. So just to let you know that I'm not an amateur in the space here in Thailand, I suppose. So I have 25 minutes. That's what I've been given, and I'm going to use it. But I have quite a few slides, so that's why I'm moving fast. But I'll spend more time on the interesting slides. Medical tourism, for the ones who don't know, is a big deal in Thailand. Last year alone, in 2024, we had more than 3 million medical tourists coming to Thailand. That's an absurd number and only going to grow from here on out. A big trend is the wellness traveler. So, of course, many tourists come to Thailand, but Thailand also is identifying the wellness traveler as a business model where, you know, you get healthy breakfast, you get massage, you get all of these type of things where people actually rejuvenate on the holiday. And Thailand is very well positioned in this space. And then the extension to it is longevity interventions. How could that look like? Well, you have first-class 5-star hospitality services. You have great scientific wellness, where you can do the blood test, the telomere length test, the body scans, whatever. And then you also have great laboratories where you can include interventions like stem cell therapy, NK cell therapy to boost the immune system, and others. And also gene therapy is being discussed on the research side, but who knows how fast it can be commercialized. Personally, I believe that Thailand can become a destination for longevity. Many people know you can travel to Turkey for dental, for LASIK therapy. You can go to South Korea for plastic surgery. I want Thailand to be renowned regionally and around the world for longevity. Imagine traveling to Thailand for holiday and you have an opportunity to return back home 5 years younger or 10 years younger. And with the puzzle pieces in place, I think that is very much possible. It's possible today, actually, but it's just not renowned around the world. That's my company, Imagine Health. Like I said, we facilitate access to these treatments. We help people also with elective surgeries if necessary, but our strength is, in fact, cellular medicine. So what's aging? And Dr. Hisham already made the great assist by speaking about the hallmarks of aging. So I'm not going to spend much time here. It used to be, yeah, I think currently it's 12 hallmarks of aging, and Dr. Hisham mentioned all of them. There is going to be an extension to 15, and the 3 that will be added in time will be community, environment, and I believe purpose, very much based on the so-called blue zones and the revelations out of that. Here pictured is Professor Guido Krömer, who is actually the researcher behind the hallmarks of aging. And for the ones who haven't, please read these papers, because in my mind, that is the breakthrough moment in the whole longevity space, to understand that aging could be a disease. And if it's a disease, what can we do to slow it down and perhaps treat it? And where does it stop, right? Could we potentially stop it? Does that mean we stop aging? So this whole philosophical aspect of it, it's very interesting. Yeah, that's the current 12. Dr. Hisham already talked about them, so that's covered. So let's talk about stem cells. Yeah, so stem cells are the foundation of the human body, right? Responsible for creating specialized cells like red blood cells, liver cells, and brain cells. Unlike regular cells, stem cells can develop into a various group of cell types through cell differentiation. This unique ability provides a steady supply of new cells for tissue renewal and repair, making it ideal for cellular therapies such as replacing diseases or aging cells and regenerating organs. Stem cells are basically our very own repair system. So it makes sense to look after our repair system first and foremost, right? If we can continue to repair our body, that seems to be the best protection mechanism. Yeah. So stem cells differentiation is a complex process, obviously, that relies on various pathways and molecules. Cytokines is one of them, a group of small proteins. These are crucial in signaling between cells and guiding cellular differentiation. Recent research has also shown that stem cells release growth factors and, again, cytokines, which interact with the environmental molecules to activate cellular pathways and therefore determine gene expression. So this gene expression ultimately determines the type of cells that develops. Also, stem cells have this very unique ability to migrate to basically damaged tissue. So there seems to be a chemical signaling process. Maybe it's the inflammation that kind of attracts the stem cells. So therefore, once the stem cells are in your body, they migrate to the tissue that needs help. Yeah? And once they arrive there, they release the growth factors, and that enhances the recovery. Let's talk about the sources of stem cells. And here, I think, starts the confusion often, not saying in your community, but often. A very renowned source of stem cells are the embryonic stem cells. These are arguably the most potent stem cells out there because they are pluripotent. We're getting to that in a moment. Just keep that in mind. They're pluripotent, and so therefore they have a high differentiation potential. Just keep in mind, embryonic are usually considered the most potent stem cells, which makes sense. I mean, they're turning embryonic state turning into human body. But of course, these type of cells are usually not commercially available because of the ethical issues. Where does the fetus come from? And also safety concerns, because there had been select research showcasing embryonic stem cells forming tumor cells. Then second group is the perinatal stem cells. So these are stem cells that are sourced at birth, at healthy birth of a healthy baby, healthy mother. And the source could include amniotic fluid, the placenta, the Wharton jelly, umbilical cord. So all of that type of material that, in not so many years ago was considered medical waste. There is a lot of stem cells in this material. And stem cells sourced from this material are usually considered multipotent. So again, not pluripotent, multipotent, and multipotent and pluripotent I'll explain in a slide in a second. But these perinatal stem cells are commonly used in research and also in therapies in select countries. Third category are adult stem cells, and like the name says, adult, these are cells from grown-ups, basically your own, mostly. So one could choose to do a mini liposuction, collect some fat from your belly, and out of this material you can actually find and multiply stem cells for your stem cell treatment. This particular treatment comes with its own sets of advantages and disadvantages, and I'll get to that. But that particular type of therapy, because it's your own cell, is available in more countries, including Australia or Japan, because it's not from a donor, it's your own cells. So therefore, regulation in some countries is more welcoming for this type of application. Now that we understand the sources, we need to talk about autologous stem cells and allogenic stem cells. Autologous stem cells mean that these cells are from your own. So your own body is the donor. Like I just already explained, most commonly is the fat, but it could also be different type of bone marrow from the dental pulp. There are different techniques, but commercially most commonly used is the fat through a mini liposuction. Yeah, and it's commonly used for orthopedic treatments or maybe even aesthetics. The second very attractive category is allogenic stem cells. So here there is a donor involved, and this donor could be, like I explained, umbilical cord. It could also be like, for example, you mentioned Brian Johnson. He actually did allogenic stem cells, meaning from a donor, from the bone marrow. So he, from what I've heard, his donor were Swedish teenagers who donated the bone marrow, etc. So that would have been allogenic because from a different source, and that would have been a bone marrow derived stem cell. I wouldn't prefer this route of action he took. I would, because normally one says the younger the donor, the better. And if you take allogenic stem cells, then you need to make sure the younger the source, the better. So umbilical cord blood is way more potent than bone marrow from an adult person. Yeah, so that's the difference between autologous and allogenic. So on this slide, I need to explain the difference between multi and pluripotency that already came up earlier. So as you remember, I said embryonic stem cells are most potent because they are pluripotent, meaning they can turn into nearly any cell type. Multipotent means this stem cell is specialized and can differentiate into a group of cells, commonly, and I'll get to that in a moment, but commonly skin, bone, cartilage, and heart cells, yeah, but not in a large amount of different type of cells like pluripotent. The problem is pluripotency you can only find in the IPS, the Yamanaka derived stem cells that is commonly not commercially available, and embryonic stem cells. So most stem cells are multipotent, which is solid. It's just not as good as pluripotency. And you can see pluripotency, because of its ability to turn into nearly any cell type, is better equipped for longevity, right? Or to treat neurological diseases, or to prevent neurological diseases or autoimmune diseases, because you can rejuvenate your whole body. So that would be the gold standard. When you research stem cells, you very quickly come across mesenchymal stem cells, and Dr. Hisham already brought that up as well. So this is the stem cell type most commonly used, and it's found in umbilical cord, the bone marrow, the adipose tissue, to name a few. And it's versatile, it's multipotent, it can help with orthopedic conditions, it can help with also for aesthetic purposes. It has strong immune regulation capabilities, so it's also good for autoimmune diseases and the like. So mesenchymal stem cells, or MSC. Yeah. And mesenchymal stem cells could be either autologous or allogenic. So here is the MSC. Up on the top, you can see the usual sources where MSCs can be found and collected from. Bone marrow, muscle, adipose, that's the fat I mentioned, and umbilical cord. And it has an ability to differentiate into these 6 different cell types. You can read them for yourselves, that in turn can turn into bone, cartilage, muscle, marrow, tendon, and adipose tissue. So which is quite amazing on its own right. Personally, in one form or the other, I've been working with MSCs with this particular type since 2008. So it's actually commercially available in China back then. So it's actually hard to believe it's been nearly 20 years. But for example, you don't see, neurons. You don't see particular organ cells. So it's a solid cell type, but it's not complete. Regarding the safety of allogenic mesenchymal stem cells, I mean, nowadays there are nearly over 1,200 clinical trials on the topic of MSCs. It has shown efficacy in the treatment of cancer, COVID-19, strokes, and autoimmune diseases. And as you can see, the number of submitted trials is obviously growing with each passing year. So it's fair to say MSCs have a very strong safety record. Nothing is 100% in medicine, but based on third-party research, based on all these studies out there, and also clinical evidence here in Asia, it's considered safe. So I taught you about mesenchymal stem cells. You have learned that they can be found in, they could either be autologous or allogenic. But you also have learned about the limitations, that it's multipotent, that it only can turn into a handful of cell types, which again is solid, but not optimal. Now, fortunately here in Thailand, there's one particular lab that has developed a proprietary technology that uses the amniotic fluid, human amniotic fluid, that's collected at 16 to 20 weeks of pregnancy. It's part of a somewhat regular genetic testing for pregnant women, making sure that the baby is healthy. And this tiny amount of liquid then can be repurposed for creating these master cells, out of which, again, these amniotic fluid stem cells can be derived. Because the timing of collection is so much younger than 9 months. Remember, most mesenchymal stem cells are collected at birth, 9 months, and amniotic fluid stem cells can be collected at 16 to 20 weeks of pregnancy. These cells are a bit of a tweener. They're nearly as potent as embryonic stem cells, but they still have the same safety and ethical footprint as regular MSCs. So these cells are classified as mesenchymal stem cells, but they are collected so much earlier than others that they have secured pluripotent characteristics. So research-wise, they're classified as multipotent with pluripotent characteristics, meaning they have shown the ability to turn into neurons, they have shown the ability to turn into heart cells and other particular organ cells, even insulin-producing cells. To me, that is the next generation stem cells, having the safety profile plus higher potency than anything else in the market. And I get to that now in a second too, with very more visual slides. So here you see the MSC again, the mesenchymal stem cells, and in white, everything with white background is the usual source and the usual ability to differentiate into cells. You can collect it, we talked about it, and it can turn into bone, cartilage, muscle, marrow, adipose, ligament, and tendon. Now, the MSC collected from the amniotic fluid can do all of that, plus everything in yellow. So they have shown the ability to turn into neural cells, liver cells, lung cells, heart cells, skin cells, and also insulin-producing cells. So to me, if someone's looking for longevity and to really get younger on the inside, that's the one, because it can actually turn into so many different more cells. And when you want to reduce your biological age, you want to reduce your biological age of your organs and of your brain, obviously. This slide is, the data is from the Sri Raj Hospital in Thailand. That is the Royal Hospital, one of the leading medical institutions here. And they have compared the available stem cell types in Thailand and put out a table, and we have just illustrated that here a little bit better. On the top, the diagram, you'll see again that the earlier you collect a stem cell, it's more likely for this stem cell to be pluripotent, and the later you collect a stem cell, the potency goes down. And that's why, for example, I would never, and Dr. Hisham said it too, I would never do a liposuction. I'm 40 years old and try to use these stem cells and try to re-inject them, because these stem cells are technically 40 years old. So if you want to do a radical impact, you need to have young stem cells. And the table below just shows you that amniotic fluid stem cells have a similar efficacy and potency than embryonic stem cells, without the safety record and the accessibility issue and the ethical issue, while being superior to other mesenchymal stem cells that are collected at 9 months, and definitely way superior than the autologous stem cells that are collected through liposuction. And by the way, I'm sharing all of these illustrations with you. I have created a shared folder that you can access after the event. So I want to go back to the hallmarks of aging, and my team has put together a document showcasing that stem cells, in particular the amniotic fluid stem cells, has actually the ability to positively influence them, most of them. So therefore, to me, that becomes the one Swiss Army knife to manage aging and potentially reverse it. In this table, you can see on the left in yellow the hallmarks of aging, the potential benefits of allogenic MSCs, the secretory factors and the cytokines responsible for these mechanisms, and then also there's a comparison between regular MSCs from the Wharton jelly or umbilical cord and amniotic fluid stem cells. Dr. Hisham said that inflammation is key, and I agree, because all the damage you accumulate through these hallmarks of aging leads to inflammation. So inflammation is the one thing that connects everything. And you can see here, I hope you can, and again, I will share it, that amniotic fluid stem cells are 3 times as effective as regular MSCs in managing inflammation in the body. And then we showcase here and we explain how stem cells can positively impact stem cell exhaustion, cellular senescence, telomere attrition. On this slide, you also see how amniotic fluid stem cells are so much more beneficial, actually very strong potency in angiogenesis. That is the creation of new blood vessels. So that is very critical in wound healing, but also in like prevention of stroke and other conditions that may be impacted by that issue. Well, so fortunately, maybe some of you already live in Thailand or in the region, so you have access to longevity interventions, something other people maybe in Europe or North America don't easily have. So take advantage of it. Stem cells, besides the overall longevity, which I talked about, can also be used for orthopedic applications. Here is a research on, that's the knee joint. And on the left, you see a low dose of stem cell injection. And you can see in white, that's the cartilage in the joint, in the knee joint. And you can see on the left how it's all gone. So you can imagine how painful that is for the client. And on the right, 6 months later, I mean, the second black box, I mean, that is the after 6 months, you can see how stem cells have regrown in the joint. So that, yeah, that's left and right. And then on the right, the the 4 black boxes on the right, this is a mid dose. So here there was a higher level of stem cell injected. And again, you can see how the bone is blank, and the white that represents the cartilage has grown 6 months after. So this would be an intra-articular injection into the joint, which is not painful, and it's outpatient-based. And you can see how that also helps people to manage pain and regain mobility, and also prevent surgery. So low dose, mid dose. On this slide is high dose, and you can see a drastic difference, right? So there's a clear correlation, at least in joints, there's a clear correlation between efficacy and the number of stem cells you inject into the joint. Right, so that is me on the right getting ready for a facial stem cell treatment. So we can apply stem cells for overall longevity. We talked about that, how it can impact the hallmarks of aging in healthy people. We talked about very briefly about the application for orthopedic conditions. So let's talk about aesthetics, and I brought you a case report. In this case, the candidate received 10 million amniotic fluid stem cells injected through very small needles into the face by an expert dermatologist. And the candidate, who happened to be me, I made sure to do a pre-Vigia face assessment, and I also did 3 face assessments at 1 month, 2 months, and 3 months after the treatment. And the treatment was last year in October. And if you haven't, please make sure or find a way to do a Vigia assessment. It's very interesting. So that is me before. Again, I mentioned it before. I'm 40 years old, and I need to explain, when you look at these reports, you see besides all these dots in my face, you also see a percentage number below. And in short, the higher the score, the better, meaning the lower the score, the worse, and it's quite low, right? So it's actually quite, as you can see already, not a good result. The result is calculated on a cohort of people with my skin type, in my age group, and in my gender. So I am in the bottom 10% in terms of spots. I am in the bottom 20% in nearly everything. So, which doesn't surprise me. I'm not a person who has a skin routine. I lived in China. I lived in Thailand. I also have sun exposure here a lot, things like this. So it doesn't surprise you that when they calculated my actual skin age, it was 7 years older than my chronological age. So I'm 40, but my skin is actually 47 on the right side and 47 on the left side. So the next few slides, you will always see 3 pages for each test: left, right, and center. So that's before the treatment. Quite bad. So this is 1 month's follow-up. And you can also already see that I think texture is up from, like I said, I was in the bottom 20%, and now I can already see that spots went from 9 to 18%. Texture is up, everything is a bit up. I'm quite ecstatic at this point. My face age has reduced by 1 year, which could already be a big deal to many. On the left, it even went down 3 years. Remember, it was 47, and 1 month later, it's 44. So that alone may be worth it. Now, this is 2 months later, and my right side age has reduced further to 42. My left side is below 40, so it's the first time I'm actually below my chronological age. So that was exciting. Right, and this is the 3 months report. And I mean, look at these numbers. I used to be in the bottom 10%, and now I'm actually in the top 10% in terms of spots, texture, and pores. As for the wrinkles, I have a very deep line here, and that is basically ruining my report. And for deep lines, stem cells can do little. Stem cells are better with fine lines and things like this. So,
Sorry,
right side.
and only. Sorry, can I ask something?
Yeah, please.
Only after one treatment, one session?
Yeah, I'm sorry. Because I'm rushing, I should have explained that. Yeah, 1 treatment. I did that in October. It's a 2-hour stay in the clinic, and that's it. And these are just follow-up.
Okay.
Once per month. So this is 3 months after. So basically January 11, My right side is 37, and if remember, it started off being 47, and my left side is down to 35 from 47. That is a simple before and after. Naturally, left is before, or the right side is after. Here's the summary. Again, like I explained, and you can see now also the percentage numbers. Spots went from 15 to 82. Wrinkles went from 28 to 88. Texture from 9 to 69. Pores from 25 to 83. And overall, and that's my chocolate side, apparently, it went from 47 to 35. And the other side went from 47 to 37. So 10-year plus age decrease. One-time treatment in October. Here you can see the progression. It started slow. And because, again, it's not Botox, it's not a filler, it's rejuvenation. So the stem cells get injected and then they repair. So it takes time and then it really kicks in. And yeah, I'm planning to do whatever, like a 6 months follow-up. And it's also important to know that the improvements you gain, they don't quickly disappear overnight when the stem cells deactivate or disappear, right? It's actually repairing your cells. So it's long-lasting improvements that only get, again, damaged again through your like movements in face and your day-to-day life and lifestyle. Yep. So I debated, but I think for the purpose of the full information, I wanted to share the prices as well. So for the treatment, here I highlighted it's around about 88,000 baht, and it's, I think most of you are from Singapore, that would be around about 3,500 Singapore dollar. And when we talk about like stem cell longevity intervention, a solid protocol for a healthy adult would be 50 million amniotic fluid stem cells injected intravenously, and that price is around about 12,000 Singapore dollar. So thank you very much for your attention. And yeah, I guess we're moving on to questions, and I'm gonna drop a shared folder into the chat box so then we can, or that you can also look at the case report again slowly. And also I added some third-party research and some supportive material, so then you know I didn't make these things up. So I'm stop sharing now. Thank you.
Thanks, Henning. So I think John actually had raised his hand just now, and then I'll go back and answer Vincenzo's question.
Yeah.
Which
in my view, I couldn't see any hands, so I could only see the slide. So I apologize.
And Lauren
if
also
you
raised her
feel
hand.
ignored.
So John,
yeah,
perhaps
actually,
first.
to be honest, it was a mistake, and I noticed I'd raised my hand. I don't really have any questions. I do disagree with a few things. I'm quite happy to have a discussion, but I don't actually have any questions.
Fantastic, right? Okay, so just to let you know, I because I live in Singapore, I can't. We don't do stem cells here. I have to send my patients overseas, so I work with people in Thailand, Korea, Japan, China, Taiwan, and anyway, wherever they want to go, they can have it, right? The only thing is that you have to be sure that you don't have cancer. Okay, if you have cancer, we will not accept you. Okay, so you need to do a screen beforehand before you do it. And I think Henning is actually 1 million cells per kilogram, but anyway, 50 is fine because otherwise it will burst your budget, right? Yeah.
Yeah, in my case, it would be 100. But yes, there's third-party research suggesting that the optimal amount of stem cells, no matter what type, is 1 million of stem cells for each kilogram of body weight. Yeah.
Yeah, but I mean, so Laura has got a question as well.
Well, now I have two questions.
Yeah, sure.
My first question, so now I'm wondering about this cancer screening thing. Is that just like for you need to do that in order to have like a full longevity treatment stem cell thing, or is that also for like orthopedic?
No. Orthopedic, because it's within the cell, not quite necessary, but some centers will still insist because there can be some minor leakage, right? But usually no problem whatsoever for orthopedic. Okay. Right.
Okay. Yeah, and then I guess my next question is like, so can you have like amniotic cells from like just any pregnant woman, or do you need to have like a blood type match, or like how do you make sure that like the particular stem cells are compatible with your particular body?
Henning, you want to go?
Yeah, sure. Matching for MSCs, because MSCs have a very strong autoimmune regulatory function, matching is usually not required, and the same goes for amniotic fluid stem cells. I mean, naturally, all donors are screened, right? I mean, there are multiple health checks, right? So that it goes without saying. But there's no matching required between donor and recipient.
No, so we do. Well, I do insist on the HIV screen, hepatitis screen, the virus, bacteria, that kind of thing. Make sure that whatever you're injecting is legit, and work with the labs and things like that. Right. Okay. So maybe I address Vincenzo's. Does that answer your question, Lauren?
Yeah. Thanks.
Cool. Right. So I'll answer Vincenzo's kind of question here. Right. Okay. So we talk about hallmarks of aging, right? But if you think about us, right, we're part chromosome, right? Chromosome, right? Within the cell, make up biomarkers, organs make up biomarkers, organs make the body. Okay. Body is the person, but the body is influenced by the environment, by upbringing, by the food that we eat, by your most importantly, your job, right, and stress and things like that. Okay. Now, when you talk, and which is why the other 3 hallmarks of aging is a bit more, fluffy and things like that, but I think they're quite important. Now, when you talk about the hallmarks of aging, right, what do you need to do? So first is genomic instability, DNA damage over time. Okay. Do you want to do your whole genome sequencing? I've done mine. I found five mutations. They can't do anything about the mutations, so I have just to watch it. Right. It's a bit like, so what, right? So that was free for me, but to any other people, it'll cost you about $8,000 US. Okay. Yeah. Because I had a friend who was another doctor, and he said, I've got a free test kit. Do you want it? I'm like, yeah, sure. Why not? Just spend $500 to send a sample over to California. Telomere, you can actually do telomere length testing. Okay. Gene expression, epigenetics, you can do epigenetics, but be careful which one you use. Like, circle DNA, the snippets are a bit longer and things like that. Okay. Protein misfolding, a bit difficult unless you want to do all these things. Okay. Right. Okay. Then mTOR, MPK, you can actually test for these, right? You can test, right? I'm sure Michelle has tested for this as well. He's amongst all of us. I think he's one of the most tested, for his body. Okay. Mitochondrial, actually, you can actually test for your NAD levels and things like that, right? Mitochondrial function and things. And then stem cells, stem cells, right? That kind of thing. Zombie cells, don't know whether you can test for that. Chronic inflammation, yeah, definitely, right? IL-6, right? CRP, all these things, you can do that, right? And then gut microbiome, you can do all that. Now, the main thing is, 1, what is your budget? Okay. 2, what do you really need to do, right? So I usually start with a set of biomarkers first, right? How you analyze the biomarkers is important. How the normal GP or normal doctor analyzes is not the way to go, right? Okay, so the analysis is very important. What you put into the analysis is also very important, right? After that, if you really need to, then you do, your DNA and everything else, right? I don't really believe in doing DNA because you can actually switch on and switch off, right? But doing some biological clocks, maybe, but you need to know how to interpret them, right? Okay. I would say things like VO2 max. The other things that give you this overall picture is quite important. Okay, I've actually got a full artificial knee in my left knee. Okay, yeah, this is basically because I was naughty when I was younger, and unfortunately got into an accident. So the fact is that I can never pass my VO2 max. So am I going to die soon? I don't know, right? But yeah, let's see. Okay. So the main thing is, right, to answer that question is start off with a baseline first, right? After that, you build up, you build up, you build up, you build up. I don't believe in all this, do everything, spend 40K, spend 100K, you know, all in one go. I believe that, longevity should be as seamless as breathing air. And that's the word that I'm trying to get. Yeah. So it needs to be wearables. It needs to be, AI. It needs to be tech, right? All these things. I have to stop now. Right.
Thank you. Cool. Yeah.
Cool. Yeah. Anyway, any other questions, Michelle? Sorry, I spoke so long. Took over your role, actually. Sorry.
No, that's much appreciated. You're making my job easier. And this was a really good session. I know we're already slightly over time, so I don't know if we have a few more minutes, or if anybody, wants to make any more comments, any more questions.
And John, happy to have that discussion together with Henning. It is, there's always, to me, longevity is so new that it's good to actually bounce off the ideas, right? No one's right, no one's wrong. Of course, there are different shades of right and wrong, but I think it's important to know.
I don't think we've got the time to discuss.
No worries. We can organize offline. No worries.
Yeah. Well, no. I post things about everything in all sorts of places. So
cool.
There's no difficulty there. Stuff on my YouTube channel as well.
Cool. I'll go and follow you. Right.
All right.
We also discussed having a Biohacker retreat maybe at some point. So it looks like Thailand is the place to go. So where should we land? I'm booking flights.
Yeah, in fact, we're starting collaborations with 5-star hotels here. There's a huge demand for, already Thailand, like healthcare, wellness, and hospitality is merging. I had the one slide, and you naturally have these clients walking into these clinics requesting these things Brian Johnson is doing, right? So while so there is a natural link with companies like mine and to build these longevity retreats. So I think that's in the pipeline. It could be Bangkok, it could be Koh Samui, it could be Phuket. So by the time you guys are ready, let me know.
Is it still an issue with the air pollution? I remember last time I was there that the air was a bit bad.
Yeah, so I believe in Thailand becoming a longevity destination, but not exactly a blue zone. So it's maybe a gray zone. I think that's quite fitting. It is polluted, especially the last few weeks. It's been quite bad, and it's very frustrating. But it started to rain, and hopefully that will push it away.
Yeah, well, I live in Singapore. I think a few of us live in Singapore. I don't think it's actually a true blue zone, but there you go. Yeah.
Yeah, if you go to Thailand, you will get their stem cells, but you will get their air pollution, so the net effect will be zero on your health. No, joking. Hopefully not.
Yeah, I recently interacted with the Bangkok-based Biohacker community, and we had a meetup and all of that, and everyone is debating what oil they use to fry their meat, and I'm like, but at the same time, everyone's running around with masks and inhaling that, the terrible poison. So to your point, is it worth it to get headaches over these seemingly smaller things when you're living in this type of place? Yeah. But hopefully it will change. It won't change soon.
Cool.
Thank you so much for the presentation. Was a lot of stuff, a lot of new stuff today for me. I learned a lot. Thank you.
No worries.
Yeah, I took notes in the Biohackers Mastermind, and I'll put the link in the chat. Thank you.
Excellent.
Well, thanks very much.
I'll also share my slides. I'll share that to Hisham. Okay.
Yeah, thank you so much. Thanks both for joining us and educating us today. We also recorded the call. We will share it internally for Biohacker DAO But if you, Henning, or if you, Dr. Hisham, also want the recording for our other friends, then happy to share it with you as well.
Please do. Yeah, happy to do that. Yeah, I think there's a few biohackers around that actually don't know that this community. They should, right? They should join.
Please tell them. Yes.
Okay. Cool.
We're always happy to welcome more people.
All right. Cool. All right. Good night, guys.
Thank you. Bye.
Thank you.
Bye.
Bye.